Welcome to the Aesthetic Angle podcast presented by Monarch Plastic Surgery. Soon to be the #1 podcast for all things related to plastic surgery, injectables, skincare, and wellness here in the Kansas City area. I'm Dr. Joe Spaniel, and I'm very excited today to welcome to the podcast Laura Vasquez, who specializes in wellness, weight loss, and functional medicine here at Monarch. Thank you, Laura, for joining us.
Thank you so much for having me.
Yeah. So just to review, Laura is a nurse practitioner here at Monarch. She has more than 7 years of experience as a nurse practitioner, specializing in prevention and integrative medicine. She is dedicated to holistic health and takes an integrative approach to wellness, combining therapies and education to help patients achieve their health goals. Laura's career began at the St. Luke's Health System in Cardio Wellness Center, where she focused on modifying cardiovascular risk factors such as obesity, type 2 diabetes, through close lab monitoring, diet education, and GLP-1 medications. She then transitioned into the integrative health field, specializing in hormone replacement, IV therapies, peptide therapy, and comprehensive functional medicine testing. Through her work, she has helped patients uncover the root causes of dysfunction and supported them with a holistic plan for lasting health. In addition to her board certification as a nurse practitioner, Laura has completed advanced training through A4M in bioidentical hormones, peptide therapy, and IV therapy. She is also certified in advanced integrative metabolic oncology through the Metabolic Terrain Institute of Health, where she supported patients during their cancer journey with in-depth lab testing, personalized supplementation, IV therapies, and diet education to minimize treatment side effects and enhance overall wellness. She's very passionate about lifelong learning, and Laura continues to pursue educational opportunities to expand her expertise in integrative medicine. Her commitment lies in helping clients move beyond a reactive approach to disease and instead achieve optimal health and wellness through proactive integrative care. Laura is so excited to be leading our Monarch Wellness team to deliver optimal health and results for medical weight loss, hormone therapy, and much more. Thank you, Laura, for coming today.
Thank you so much. And thank you for believing in functional medicine and overall wellness. And so not only do your patients and clients get to look great on the outside and have confidence, but they now can also start to feel better on the inside and have that reflect outward.
Oh, absolutely. It's exciting. And as an aging, person myself, we don't always, we want to feel like, you always want to feel as good as you can. And I think at Monarch, we often are able to help people look the way they feel. But I think with your help, sometimes we'll be able to help people feel the way they look in the other direction too.
Absolutely.
So yeah, it's a very exciting time. What does integrative health mean to you, Laura?
I would say integrative health means looking at health from a whole body perspective. So not just the systems that we think of, heart, liver. And so really wanting to tap into getting your health optimized and using more natural testing tools to do so.
Okay. And I often hear about functional medicine too. Is there a similarity? Is there crossover? Are they the same thing? Can you help sort that out for me?
That's a really good question. So integrative health and functional health are very similar, getting to the root cause of the symptoms, identifying that, and then treating that again from a more natural standpoint, which is not typically, and it can be medications, which are used off label, but supplements, a lot of lifestyle modifications, and looking at, their mind, their body, their spirit, and putting that all together. Integrative health tends to, and those practitioners may have extra certifications in acupuncture or herbal therapies. So there's a little bit of a different education, whereas functional health has more of the functional medicine testing that we do.
Okay.
But yeah, again, same perspective on health, testing and treatments, very similar.
I got it. Okay. Interesting. No, I love that, what you said about treating like the human spirit too. Like I saw a study not long ago about playing pleasant music for a patient while they're asleep under general anesthesia and how it changed their pain scores afterwards. Like,
yes,
there's so much going on that we don't know about. And I mean, we learn about a lot of stuff in med school and in all of our training, but there's still a lot going on in the human condition that I think we're only scratching the surface on.
Yeah, and to only look at one aspect of it and not take into consideration, like you talked about the spirit or just like music and what that does and what we know it does. I mean, there's studies with plants, right? And how plants thrive with certain tones of music. And that's a really cool study. But we know that, just your outlook on life, community, all of these things that are part of health, we should take into consideration. And I feel like functional and integrative medicine will touch on that. And as you're working with patients, you want to look at all the different, all the different foundations and aspects and not leave any of them out.
Yeah. Yeah. I love that. So when a patient comes to see you, where do you start? What's the first sort of visit like?
So I'm obviously wanting to get present, past medical history, medications, all of the general, and then really diving into symptoms and then analyzing patterns. Okay. So we're not just, looking at one symptom or more of a focused issue. We're kind of looking at the whole picture. Okay. We're really getting their lifestyle patterns down, getting to know them, their personalities, so you can form that connection, which I think is so vital. And a lot of times in conventional medicine, not at their fault, they don't get to spend a lot of time with patients, so you get to form this relationship where they trust you, you get to know them, so you can really dive in deeper and help them with whatever the issues are, the chronic conditions or just kind of vague symptoms. And I think when you form that relationship as a provider with your patient, the outcomes can be so much greater.
Sure. So what sort of condition or disease process would someone have that they typically seek integrative or functional medicine therapy for?
Yeah, so I feel like it can be several things. In my experience, just people who have chronic conditions that are getting sicker on more medications, and they're really looking for maybe alternative testing or other adjunct therapies they can incorporate where we don't tell them to stop taking all your medications. Sure. We just try to figure out what else is not optimized to help them obviously either slow progression or feel better from a symptom standpoint. And then two, I would say a lot of people that just have vague symptoms, fatigue, maybe digestive abnormalities that they really can't get a diagnosis for because there's not a disease, that they have been labeled with. Right. Or just, so many different vague symptoms. And so those patients really can't get answers when they get kind of basic lab work. So they're looking for someone to dive deeper and to look kind of at the whole picture and really figure out, or how can I feel better? How can I optimize? Maybe it's nutrient deficiencies, inflammation, oxidative stress is a huge one. And then I'd say the third, which I hope more people will, I guess, be looking for this, is prevention. So before you actually are sick, before you have a disease process that's harder to reverse or slow down, looking at all the different biomarkers, if your immune system, again, inflammatory, metabolic, so really kind of honing in. And then, our health is in constant, right? We're constantly fluctuating on our kind of these biomarkers, but really learning how to take better care of yourself or what you can do lifestyle wise to prevent disease. Yes. So those are kind of the three subsets, I would say.
Which is the hardest thing for patients typically to modify?
That's such a good question. Probably different for everyone. I would say diet.
Yes.
Right?
That would be my personal one.
It's my personal one too. And I love cooking, and nutrition is such a passion of mine. But yeah, I think it's hard because just the modern day food, that we're surrounded by has a lot of toxins, hormones, and we can get into that another topic, and just so many processed foods. So our diet compared to our ancestors is very different. And that is one of the most important aspects of health, that just foundational, right? Our food vitamins, is medicine, right? Food is medicine, and so that's,
Do you have, is any specific patient story come to mind that could highlight maybe how he or she showed up and how you helped them improve things?
Yes, I was thinking about this. So I had at my old integrative clinic, I did a lot of obviously the integrative oncology with the integrative oncologists that we had. We all worked together, and then I had more general patients. And so I really like working with autoimmune patients, obviously very complex.
Yeah.
But I have found there's so many things we can do from like a functional medicine standpoint, testing and treatments that they improve quite a bit.
Really?
And so this patient had had rheumatoid arthritis for over 20 years. And usually, when you develop one autoimmune disease, the likelihood of developing two, three, four, five is very high.
Oh my gosh.
Yeah. So she's very sick. She's been sick for a long time. She did have a job, but wanted to be able to play with her grandchildren.
Yeah.
She was still relatively young, I would say in her 50s. And so we obviously did a huge micronutrient panel. We did other functional medicine testing. We knew she had a lot of inflammation, right? Systemic inflammation. She was on, I think, 5 to 6 couple biologic drugs. She was on a lot of medications, methotrexate,
Oh my gosh.
for years.
She was ill.
Very sick. Yeah. She was overweight because she couldn't really walk well. She had, flares, the swelling, the pain, the inflammation. So we started with the testing because you don't want to guess. I already knew things would be obviously her immune system, inflammation markers. I already knew things, certain things, possibly low vitamin D. Once we got the information back, then we could really pinpoint what supplements or other nutraceuticals we needed to, really focus in and hone in on. I did use a medication from a compounding pharmacy that is used off label for autoimmune disease, which I think made a huge difference for her. And then huge was her diet. We put her on autoimmune paleo diet.
Ooh.
Yeah. And this is,
Tell me about that.
And she told me, I don't think I can do the diet. And I said, I had to really be her support, be a cheerleader for her and be positive and tell her how important this was going to be. And that obviously I could guide her with what I recommended, but I know for any patient, they have to take those steps and be accountable, be consistent, actually have the motivation to make these like significant changes. So she couldn't have chocolate, which she loved.
You can find paleo chocolate, right?
I don't know. I've never had it.
No? Okay, I must be thinking of something else.
But dark chocolate,
Okay.
But there were certain things with the autoimmune protocol you can't have. It's more of an elimination.
Paleo itself is not easy, right?
I don't think it's easy. No.
I've never tried it, so I guess I can't say. But.
It's just really you're eliminating the grains. Obviously sugar, grains, processed carbs, really mostly carbs.
Okay.
So it's going to be more protein and green vegetables, like low glycemic index. And so anyway, we did an elimination diet, which I know was extremely hard. I gave her the information. We had a lot of visits, follow-ups, questions when she felt like she couldn't do it. And then it's just amazing. She started after a couple months losing weight. Her inflammation, she could just feel it in the mornings. Her joints weren't swollen. And she lost just getting her inflammation and metabolic health under control and getting her immune system working better again. She lost about 80 pounds in a year or less than a year.
Wow.
It came off almost all the medications.
All of her like DMARDs and stuff?
Yeah.
Oh my gosh.
I think except for one, they had reduced the dose quite a bit. So yeah, I mean, she just, and we had like such a close bond, me and her husband, but I always told her, I could do the testing and we could figure out the plan, but you're the one that executed it. Yeah. You're the one that wanted to feel better. And so it was really up to her. And she made those changes, and she is, a completely different person.
Yeah.
And I'm so thankful I got to work with her,
But how rewarding for her to like have it was her own work that paid off.
Exactly.
Like training for a big race or something.
Yeah.
Wow. What does like when a patient like that has such a rise, what's the rheumatology community have to say? Like do these things happen? Is it common? Like
I think it's more common than maybe we hear about. I know her rheumatologist was wanting to know everything she was doing, of course.
Sure.
So I said, yeah, let him see the treatment plan. And so I never got to meet this physician, but I do think this type of, when you're already chronically ill for so long,
Right.
it's harder to have an outcome like she did.
100%.
It's not all the time, and it's not necessarily 1 in a million, of course, but she was really committed to feeling better, to really getting control of her health. And just with us working together, I know her doctor was amazed.
Yeah.
Because he told her, you'll never come off these medications.
Sure.
And right, if she hadn't made these changes and we hadn't really worked on everything that we did in every single way, she reduced her stress. Again, another big one, right? We talked about what stressors were. Some are physical, some are going to be what you perceive as stress. And how do you mitigate that? How do you find that out? So she started doing yoga, meditate. I mean, there were so many different things she did in every aspect. And that's why the outcome was so great, I believe.
That's impressive, really. So she had to make nutrition changes. I guess it was a lot of eliminating things. What did you add for her? Did you add supplements or?
Yes.
Okay.
Yeah, I do know, well, like most people may not be deficient in vitamin D, but a lot of, especially with autoimmune, you want to have it, and the research supports is definitely over 60, closer to even 80 to 100. Patients tend to have less flares when they're in an autoimmune type, inflammatory phase. So we had to really optimize her vitamin D. And she's like, well, my doctor says it's normal. It's 32. Well, you're not deficient by the scale, but definitely need to have excess vitamin D when you have these type of conditions. I know we did some anti-inflammatory, like proteolytic enzymes, obviously curcumin. I don't remember everything that showed up in her testing. Her microbiome had a lot of inflammation in her microbiome, which is directly tied to our immune system.
Sure. And so that was part of the diet reset.
Yes.
Right?
Yeah.
So was she on probiotics then to get that all?
Yeah. And that for her was, indicated, but kind of we wanted to remove everything that was triggering the inflammation and just her dysbiosis, the bad bacteria versus good bacteria. And so we just had to kind of do like a cleanup phase and then do step by step.
Okay.
So it is a commitment. It is something that's not a quick fix. I think most people going into wanting to experience functional medicine or integrative medicine know that this is going to take work on my part and this is going to be a process.
Yeah.
And I want to trust in this. So yeah, we did a lot of different supplements, but kind of in different phases, depending on where we were.
Okay.
And she was able to add back in certain foods, which isn't always the case. But most of the time, if you heal the microbiome, you can. So we were able to, she can have some chocolate again and stuff. It just, we had to do a period. So
Did
there's
she
a
have
lot
grain again?
Yeah.
Did she get to have grain? Okay.
Yeah, not a lot.
So this was after about a year. You started reintroducing things? Okay.
Yeah, certain things, no.
Yeah.
But yeah. And everyone's going to be a little different. And that's why this approach is, it does work so well because you're really tailoring medicine to this individual, their biochemistry, what supplements they need, what are the changes they need to make, because we're all similar yet, unique.
Yeah.
So.
Well, it's like genetic testing for cancer. Like, they can send a sample from a melanoma or a breast cancer or whatever and have it compared to an array of thousands and compare, how this one behaves based on all these other ones. I mean, it makes total sense. It's individualized, and then you can tailor the treatment plan. So
yeah.
It's really neat. Okay, so we talked about diet, and then you had touched on stress, sleep, and mental health. So how important are those things, and how do you address them in your practice?
Yeah, we did kind of, as we've been talking, I think every aspect, like foundation of health, right? Your stress level, your circadian rhythm, which involves your sleep, your restful sleep, your nutrition, exercise, all of these foundational things are very important. And as we kind of already discussed, or I mentioned, I don't think you can leave one and neglect it and still get the right outcome.
Sure.
You might move the needle, but if you're on your phone and you're going to bed at midnight and you're waking up at 6 and you have a stressful job and we all have, other commitments, and you're not having that work-life balance and you're not identifying that and taking steps to reduce that, then we're still missing a part of what could optimize you to get you to whatever the goal is. So
yeah, makes sense. Like you have to check these things off. Got it. It's the whole, you have to kind of, it's an all in kind of thing. Yeah.
It's the whole package.
Yeah. What are some of the diagnostic tools that you would use compared to like a traditional doctor's office? Like you mentioned, this patient, her vitamin D was normal, and so the doctor was like, "What? It's normal," but that doesn't mean it's
optimal.
Optimal, yes.
Yes.
Thank you. So what are some diagnostic tools that you employ?
Yeah. So functional medicine testing. I mean, there's lots of different companies, lots of different tests out there that are comparable. One that comes to mind is hormone testing. So we can do salivary testing for hormones, which is going to show you not only the bound hormones, but free hormones if you're not on hormone replacement. So it's a great baseline. And then we can check your cortisol levels, which we know rise as we awaken and fall as they should. There's this pattern and it has to do with our melatonin. They're opposite. But anyway, so we can do more, not just do a blood test as if you went to maybe your primary care and said, I think my hormones are off. And they would say, well, you are in menopause. So of course you don't have a lot of hormones, right? And so we already kind of know the levels are going to be mostly low for testosterone and progesterone, estradiol. Anyway, in functional medicine or integrative medicine, we can look at the whole, thyroid cascade. We can look at the cortisols. We'll look at the sex hormones, your DHEA, which is adrenal hormone, precursor to testosterone. So we can do a Dutch, which is a urine metabolite hormone test, which actually looks at the pathways and how you metabolize all the different steroid hormones, all the estradiols, precursors to hormones.
Oh my gosh.
Yeah, it's a huge test. It gives you so much information. It looks at ADOH. And so this is going to talk about your oxidative stress levels. Oh, okay. which is, obviously can lead to cancer or all these chronic diseases as we age. So, anyway, I'm just getting really excited, but there's so many tests that we can do.
Yeah, you're mentioning tests I've never heard of.
Yeah. And there's just so many of them. And, any physician or provider, I'm a nurse practitioner, can order these tests. But if just like, a specialist, right? You work in plastics. I wouldn't know how to do your position.
Sure.
And you want to have a provider that knows how to interpret these tests and how to treat whatever shows up.
Right.
So
you're going to pick tests based on the patient presents, where they are in life.
Yeah.
And
yes.
So based on what they tell you in their story, it can make you think of different areas of the body to focus on, and thus which tests to
yeah.
Get. Okay.
Yeah, that's what I think is always best. Obviously, you want to get the symptoms, get the history, and then there's so many different tests, but kind of hone in on, yes, this looks like it's possibly hormonal. Okay. And as you know, it could be a few different things. And most time it is. Yeah. So you kind of have to get kind of the overall picture and then decide which test is next and just start working. I would say from that angle.
Sure.
Is how I do it.
Wow. Okay. Is there one integrative therapy people might be surprised to learn about that actually has strong evidence behind it?
There's a lot. And I think that would be
top 3.
Oh my gosh. I think that would be a great, because I was thinking about this question for even a different podcast. I know we're going to be doing multiple.
Fun. Can we do an appetizer? Can you talk about 1 or 2?
Yeah, I would say I don't have the research study off the top of my head,
Okay.
but just this is what I would say though. And I would love when we talk about the microbiome on a different podcast to really bring this so that everyone can have this information to understand it on a deeper level.
Okay.
The microbiome, right? We are bacteria.
Yes.
So they are now...
There's more bacteria cells in us than our own cells, right?
Yes.
By like an order of magnitude.
Trillions.
Yeah.
And I don't know the exact numbers.
Yeah.
So the research, they're finding certain bacteria in the gut that is linked to Parkinson's disease.
Oh, wow.
And a lot of neurodegenerative diseases. And so they have identified, they're isolating other bacteria that have a role in metabolic diabetes, right? And so it's just one part of it, the whole puzzle of why someone develops a chronic disease. But the microbiome really is, health begins in the gut.
Okay.
And a lot of the founders of medicine in general, a lot of the first physicians knew this, how impactful unbalanced bacteria was. And so tons of research on that. And I would love to discuss that more in depth.
Okay.
Because I think it's really important for everyone to understand that is something that almost anyone, whether you're sick or not, should get tested.
Sure.
And should get analyzed to see where you're at.
Yeah.
And there's different methods to do that.
Yeah.
But that's one of my favorite kind of functional medicine tests to do is look at the microbiome.
Okay.
And to kind of clean that up and improve that. And yeah.
Okay. And then people can live a little bit more informed life.
Yes. Yes, for sure.
They could say, oh, that explains why I don't feel good after I eat this or whatever.
Yeah.
Here's why. Okay. Okay. So there's some misconceptions about functional medicine. Some people think it's not real medicine. How do you respond to that?
Yeah, I have heard that. And I would say this is actually getting to the root cause of medicine. And so I was trained in conventional medicine as a nurse practitioner, worked in the hospital. There's definitely, and I did cardiovascular ICU care. So the procedures we have nowadays, the technology is amazing, right? Valve replacements and just acute care and all of the things we need. But when it comes to really getting to the root cause, and people think, well, this functional medicine, integrative medicine, I don't know what this is, because they've never practiced it, they've never experienced it. It really is, like I said, getting to the root cause of the underlying dysfunction and working from a more holistic point with your lifestyle, and again, targeting supplements and nutrients, all kinds of things to really optimize you and not just have you have normal labs.
Yes, right.
But what's optimal for you.
Sure.
And so it is real medicine, and there is real research, obviously tons of evidence-based research. I think too, people maybe get skeptical because there's not as much money that has been put into, more integrative therapies, or medicine in general. And so the bigger trials are funded by, as you know, pharmaceutical companies, and there's just more funding available to conventional treatments.
Right, sure.
So neither one is wrong, but I think blending the best for most patients is always the best.
Yes.
Yeah.
And I haven't been in practice that long, but I've met enough patients that have told me things that worked for them, and it's the proof's in the pudding.
Yeah, exactly.
I had a patient who told she had a lipoma on her scalp, like a little fatty growth underneath her skin. They're relatively common. And she was convinced it was giving her migraines. And I was like, I mean, you can get migraines based on like a compression neuropathy from the nerves that exit the orbital foramen or the occipital foramen and stuff. So you can get migraines from specific nerve compressions. But I was like, I mean, this lipoma on the side of the top of your head, I don't.
Not causing a lot of
pressure. I'll take it out, but I don't think it's going to
Yeah.
help your migraines. And I took it out, and like 2 weeks later, she's like, "Thank you so much. I don't have any more migraines." And she wasn't lying to me. I mean, it was amazing. And I was like, okay. I mean, there's a lot going. What I'm saying is, there's a lot more going on than we are taught in traditional medicine.
Yeah. Yeah. So maybe it was, there's some kind of inflammation in that area
right.
that we wasn't going to show up on a blood test.
Yes.
But, and you, as we know, patients know, or, we know ourselves best. So we know how
Right.
we feel, how we felt before.
Yep.
Yeah.
Or I've had patients who have had skin cancers before, and they have a bunch of spots all over, and they're like, this one's a cancer, I know it. And you're like, how do you, it looks like the other ones you've had. And they're like, no. And they'll say something like, no, this one, it acts differently. And then you're like, okay, well, we can biopsy. They're often right.
Right.
Like,
yeah. Because they know.
yeah.
Yeah.
Yeah. So to
There's
your
some
point,
intuition,
we know ourselves best, and people like you can help us with that. So, are there any, we talked about a few of the misconceptions that you've started to clear up here. Are there any others that you wanted to highlight?
I don't know. I would say maybe drawbacks to why people may not be able to receive.
Sure.
I think that's a big thing that's come up, is just insurance at this point doesn't cover a lot of the functional medicine testing. So it is out of pocket. And it just depends on what test, but it is hard because patients have insurance. And so we can get some of the labs, not depends on what program you're working with. But yeah, you can go get some baseline labs. A lot of times insurance isn't going to pay for more detailed labs when there's not an ICD code or not a reason to check those. And again, there's just not going to cover.
'Cause it's reactive.
Yes,
medicine.
exactly.
Yeah.
Exactly. And so, I think that's unfortunate for a lot of people. They may just not have access to a clinic, a provider, or able to afford it. And hopefully in the future that changes. But
Got it. What's one small step anyone listening today can take to start supporting their health in an integrative way?
I would say just basic. You could sit down and write down your diet, what could improve. Are you exercising? Are you moving? Do you have a sedentary job? So kind of analyze yourself and your patterns, and where you're at this point. And then you could look at your sleep cycle, just kind of look at all these, your stress, of course. And then I would say focus on one area.
Okay.
So if you look at that and say, I know my diet is not what it should be. I'm not eating enough different colors. I'm not eating enough whole foods. I'm eating out quite a bit. You could just really hone in, because I think it's hard to make all of these changes or even know.
Sure.
What am I supposed to do? I think that's overwhelming. And that's why, there is practitioners like us that can really help you with these modifications that are right for you. And you make those changes as we walk you through that. But I think that's an easy thing to do.
Okay.
And someone may identify, it's the big one for me is I don't sleep well. I don't go to bed on time. I don't have the same sleep schedule. And that's, again, can be kind of difficult to get into that for some people. Depends on your lifestyle and what's going on with your work and your family. But yeah.
How do you recommend someone track their sleep cycle?
Oh, that's a good question. Well, there's a lot, and I don't have one, but there is, I think it's called the Halo Ring.
Yes.
You've seen that.
Is it Aura?
I don't know.
Ring. Okay.
Yeah.
There's a ring.
I think there's a ring. I know there's a ring.
Okay.
And there's maybe a couple different ones, but that's a great way to see how deep you're sleeping, and the different level, different rhythms of sleep.
Yes.
I think that would be, there's so many amazing apps and programs to help with our health.
Okay. So you do put some stock in those sort of technologies.
Yes. Yeah.
Okay. I've met people who use their watch can tell them how well they're sleeping and stuff like that. So, okay. If someone is curious about functional health, what should they look for in a provider?
I would say, obviously, check out, there's a lot of different programs out there. It's exciting to see people are open, and there is a need, and people, are wanting to get into exploring their health more in this way. Yeah, I would want to meet that provider and just see, do I feel like they're a good listener?
Okay.
Are they able to educate me where I understand? Okay. Just kind of, as we meet any physician or provider, you want to feel comfortable with them. Okay. And so, I think that's just important too, and kind of what you're looking for and what they offer.
That's different than what I expected you to say. I was thinking that with your background in traditional medicine that you would recommend someone look for, someone who, either went through some sort of a traditional school, either,
Sure.
so that they have
Both.
can balance both things.
Yeah,
That's
that
what
is
I
true.
personally would look for if it was me or a close friend or family. But no, I appreciate.
Yeah,
your
that's
input
a
too.
really good point. I think it is important because I got to train in that and work in the health system for 12 years
Right.
in the hospital. And so I know all the aspects of that. And then getting to transition has been so amazing because
Right.
I've gotten to do both.
Yes.
That is true. Yeah, that is neat.
Okay, so what can listeners look forward to for future episodes? So we're going to talk about, we haven't even said the word yet, but peptides,
Yes.
which I'm excited about. I was asking you about a few earlier that a patient had put herself on, and her wound healing is amazing. So, and I didn't even know what peptides were a few months ago until you told me.
So exciting.
Okay, so peptides is one, right?
Yes.
And what else are we going to cover?
We are going
We
to cover,
mentioned microbiome, so gut.
yeah, so
Okay.
gut health,
Gut health.
which includes, of course, your liver, gallbladder, all of it. That's going to be really exciting. Bioidentical hormones.
Okay. Oh, yes, of
Yes,
course.
yes, of course. We will talk about GLP-1s.
Okay.
And I think it would be fun, maybe after
GLP-1s being this Wegovy,
yes,
tirzepatide, Mounjaro,
tirzepatide,
all those.
semaglutide,
Yeah.
yes. And the benefits that we're seeing and the research is showing not just independent right of weight loss,
Yes,
but
yes.
reduced inflammation,
Cardiovascular health.
Yes. So I think that will be really great to discuss. And then I think it would be fun. Maybe we could just do like question and answer,
Yeah.
just from our clients or people that are curious.
Yes,
And so that would be fun too.
I agree. I think, I'm excited to see what listeners are wanting to hear about from you, because I think it's really interesting field, and we're so lucky to have you here.
Thank you so much.
yeah.
This was really fun.
Yeah, thanks for
Look
coming,
forward
Laura.
to doing it again.
I look forward to it. All right, that's been another episode of The Aesthetic Angle. Thank you so much for joining us, and we'll look forward to seeing you next time.